I asked the question before. The question I asked about, do you feel that it's mostly Democrats that have supported the trial attorneys over the years and have opposed tort reform? The reason why I had asked that was if it's true that it's been primarily Democrats, and I know, you can't totally stereotype it because you do see, crossing the line on different issues. You'll see Republicans with Democrats or Democrats with Republicans, depending on where you're coming from in the country and where the issues lie. But do you see if it's possible that the Democrats would yield their longstanding opposition to tort reform as a way to find a compromise with the GOP on Obamacare, meaning that the Democrats could simply say, look, let's put an end to this. You give us Obamacare, we'll give you tort reform. Do you see something of a grand compromise like that, or is that really out of the question?
I think that's too grand of a compromise. Washington is a town where you see deals being cut all the time.
There are no more Daniel Websters in Washington.
Yeah, exactly. But that one's a little bit too grandiose, I think, at least to my my ability to think about it. But there may be some type of a smaller compromise where you would see some folks concede on tort reform in exchange for something else. And, obviously what that something else might be is open to conjecture. I don't know if we could even speculate at this point. So, it's compromises are always possible, and that this may be an area where there would be an opportunity for some compromise.
Now, notwithstanding the GOP and the GOP maneuvering on Obamacare and the court challenges to the law, could its ultimate demise potentially be due to this ever-increasing debt problem, which is now becoming the prime center focus because of the Tea Party, because of the November elections? Do you think ultimately this might all be much ado about nothing because we just might not be able to afford it?
Well, I don't think there's any question that whether or not we can afford this in the future is a significant issue. The question is, how far forward, when will those costs actually occur, and the willingness on the part of folks to absorb those costs or the implications of it. It's an interesting thing here. When we talk about cost of healthcare in Washington, very often people will characterize it as a percentage of GDP or percentage of government spending. You'll hear people talk about bending the cost curve. And in Washington, we tend to think of the cost of healthcare in its aggregate. But if you talk to people around the dinner table, around a water cooler, in the coffee shop, and you ask them about the cost of healthcare, what they talk about is what is it costing them at an individual level, whether it's the cost of a doctor's visit, an emergency room visit, a hospital visit, or the premiums that they're paying or their employer's paying for their health insurance. And I think that was one of the big disconnects and missed opportunities in healthcare reform, where so much of the debate in Washington was focused on trying to bend the cost curve, the aggregate cost of healthcare, and very little attention to what needs to be done to control costs at the consumer level or help bring that down. As an example, I serve on a local health board, and we have a fairly large hospital system. And for years, the hospital has been telling us that we're paying more for healthcare in our county because of the number of uninsured who are coming in, not able to pay, and that results in higher charges for those who do have the ability to pay for healthcare. And we heard that very often during the healthcare reform debate, that this hidden subsidy, this hidden tax, if you will, that we all pay for providing care to individuals who can't pay for their health care. And so I asked them the question. I said, well, for years we've been told that there's this hidden tax that we're all paying for providing care. I said, now that healthcare reform has been passed, we're going to significantly increase the number of individuals who have insurance. So we're going to decrease the number of people showing up in your ER who don't have the ability to pay. I said, when do I get my hidden tax cut? He kind of turned his head like a dog does when he hears strange sounds, and he was like, well, what do you mean? I said, well, if you're telling me that the cost of the unit of service that I've been paying for was artificially high because of cross-subsidization, and now those individuals are going to come in and have the ability to pay, are you going to lower your ER fees? Are you going to lower the fees for a hospital bed to reflect the fact that you're not carrying that level of debt that you have to transfer to other patients. And he didn't know how to answer, and he said, well, I don't think we have any plans to reduce the cost of a hospital bed or ER. So where do we as consumers then benefit? I mean, if for years we've been paying a hidden tax for the millions of people who have been accessing the healthcare delivery system, we're now going to pay to subsidize individuals through the purchase of insurance, but we're seeing no relief at the provider level in terms of reducing costs. How have we benefited as consumers?
And with that question, Bill, we're going to have to leave it off there. I mean, it's a fascinating question to ask, and it's a great perspective, a great way to look at it. I want to take the opportunity. We could go on, I know, for hours on this subject, but I want to take the opportunity for taking time out of your busy day to come down and talk with us for a few minutes here on the Healthcare Business Network. Thank you so much again.
Thank you, Ron, for the opportunity, and thanks, folks, for listening in, and appreciate the chance to talk to you.
And we appreciate it. And, Bill, if people do want to contact you by email, would they be able to do so?
Sure. I'll give you my email. It's BF, my initials, at Capital Associates, CapitolAssociates.com.
Bill, I want to take again the opportunity. Thank you so much again. And I want to thank our audience again for listening in this week. I want to thank our assistant engineer over the glass here, Kevin. And again, we will be back here next week with another informative show on the business of healthcare. Again, I'm your host, Ron Nyman. And good luck, and may the good news be yours.